I'm just going to put that on there because she's an in-home care provider. Her mom's an RN, so they've been watching the process and warning me and had my back, and they're the ones that said to check for blood clotting.
Yeah, well, it sounds like you've been more swollen in the last week, you said, right?
Noticeably.
No pain.
Well, some pain, not here, but only where the injuries were.
Right. So no pain in areas where you did not have your injury.
Correct.
Okay. And so we were talking about, like, when did this happen? Did this happen last week when you started have more swelling? Or did this happen, months ago? The ultrasound shows the clot to be, at least the appearance of it looks like it's more of an acute clot. But that could mean that it's anywhere from the last several weeks to yesterday.
Okay.
So I don't know when that started. But the teaching on this nowadays, it used to be that everybody gets blood thinners. Nowadays, they kind of revise the guidelines and they say, look, if it's the smaller veins and it's focal, you don't have to do blood thinners. Unfortunately, in your case, it's more than one vein that's involved, and it's not focal. It's spread out in these still pretty small veins. But it's not just like one area of the vein that's got blood clot. Several veins have blood clots in them. And so you do have what's called deep vein thrombosis. I'm talking a little louder so your wife can, when she listens to it.
I was researching that when I was waiting because I never heard the term before.
Right. So it's a DVT, or deep vein thrombosis.
Okay.
And the danger with deep vein thrombosis is that a part of the clot breaks off and causes blockage of blood that's going to your lung. And so it becomes a pulmonary embolism.
Okay.
And the end result of that is, one of the end results is that you just don't get enough oxygen in your blood because massive clot in the lungs. I don't think you have that. This is very, very distal. So the risk of this doing that is smaller than if the bigger veins in the thigh or in the pelvis became involved with a blood clot. Okay.
To put it in perspective, 5 years ago, I think I got open heart surgery.
Yeah, I saw that.
Double bypass, right? There was a blockage. They were going to put a stent in.
Yeah.
They didn't do that because they found out I had inherited the descending coronary artery that supplies blood to the heart was very, very small, something I inherited. Yeah. So they replaced that with a bigger one, and then they did another one too at the same time when they were in there.
So they bypassed it.
Bypass, yes, double bypass.
But you've never had a blood clot that you know about in the vein.
That is correct.
And there is no family history in your biological family tree of blood clot.
Blood clots or people on blood thinner, no. And to be honest, I have 13 younger brothers and sisters all alive. So,
perfect.
I mean,
and so common things being common, I'm sure that this is related to the injury that you sustained at the end, 2 months ago or so. And now when it arose, whether it's 6-7 weeks ago to a week ago to in between, I don't know. But you do need treatment.
Okay.
And several reasons. One, because it's fairly extensive. Even though they're only the small veins that are involved, there's still more than one vein that's involved. And two, you're not fully mobile.
Correct.
And so one of the risks of developing blood clot is when you're not able to move around as well.
Okay. And
so you do need to be on blood thinners for this. So the risk of blood thinning, as I'm sure your wife and her mom would know, is bleeding.
Okay.
And so bleeding either in the GI tract, so you would either vomit blood or have belly pain and maybe have really black stool, like the color of your shirt black, or bright blood in the toilet bowl. So those things, no good. Okay. So let us know about it.
So those are 3 things I have never had.
Correct. Yeah. Obviously, you don't want to be hitting your head when you're on blood thinner, right? So falling, things like that. No riding.
So extremities, it'll bleed.
Normal activities. Except for, and even obviously people are on blood clots and they ride their motorcycles and they do their skiing and such. Not that you're going to be doing any of those with your leg,
No,
not
I
yet.
think it's a good time of the year to take a break,
Right,
heal.
correct. But there, I mean, you do what you need to do, but there's risks, obviously. You will not need to be on it forever. This is your first episode. It's provoked. We know that you had an injury and therefore had been immobile, so it's not like out of the blue you got a blood clot, which
Okay.
would be a fairly different scenario. I don't think we need to kind of look for causes in your genetic material, in your blood, as far as being hypercoagulable or prone to forming clots, because again, this is provoked. And typically, we put you on blood thinners for 3 months.
Okay.
And there are many options, including Coumadin, which is the oldest option, one of the oldest options we have. But nowadays, the recommendation, the first line for this is what's called the NOACs or the DOACs, which are the novel oral anticoagulants. These are your Xarelto, your Eliquis, the Pradaxa. So
Those are
all
names I have no context
right.
about.
Your wife will know them. Her mom would know them.
Okay.
But they're basically a relatively new drug class, and they're pills. There's no need to check your blood for any kind of level. We use Eliquis quite a bit, or Pixaban. You take it twice a day.
Twice a day, like once in the morning, once in the evening?
Correct. Yeah,
Okay.
we'll have the nurse come in and tell
I'll
you.
learn that. Yeah.
There's a loading dose period where you take a little higher dose and then you go on the regular dose. But I suspect you'll be on it for just 3 months. I want to get you back here a couple months and a half from now,
Okay.
just to recheck this, right? And then if that's the same or better, we can get you off the blood thinners at that point. So
Okay.
by the time all is said and done, it's usually about 3 months.
So that's a little bit of something I can do. Take the meds, and then we'll see you.
Oh, we'll
beginning of the year, right?
schedule you before you leave. We'll schedule you for a repeat.
Are there
Now-
anything else I can do to help?
You look for symptoms, right? So if suddenly you wake up and you can't breathe, or you have chest pain, or the swelling is worse, or the pain on the calf, which you do not have. You have palpitations, fever you can't explain, coughing you can't explain. Come on in and
Okay.
get checked. And the best way to do that is not here, because I don't have any lab or any scanner here. Urgent care or CT or ER
Okay.
or something,
Okay.
or primary care if they have those things. But so those are the symptoms that you watch out for.
Is there for blood work? Because normally I'm about due to go in for full blood work for cholesterol and kind of annual physical.
Yeah.
So does this medication affect kidneys or anything like that?
Typically not.
Okay.
Typically not. You're pretty healthy other than your heart operation. I didn't see anything else that.
Yeah, we've been pretty active.
Yeah.
Yeah.
Good.
This was a major setback,
Oh, I bet.
but for both of us. But
Yeah.
it's temporary, and then we'll be out kayaking
And all
walking
things
and everything.
considered, I mean, it could have been worse. High speed. Yeah.
I know. Yeah.
So still okay. But though signs of bleeding, like what we talked about, headaches that's unusual for you, vision changes, anything of concern that you don't typically have,
Okay.
or even things that you have but worse, those are things to kind of think,
Okay.
and say, and don't go, well, I'm just gonna sleep it off and I'll be fine. So that's one of the risk of major bleeding with these blood thinners is very low, very low.
Okay.
But people can get nosebleeds if you're prone to nosebleeds and things like that. If you've had an ulcer in the stomach that you didn't even know you had, and now we're giving you blood thinners and.
Okay. So I mean, so
Are you
far
taking ibuprofen or any kind of Celebrex or anything like that?
sometimes for the pain,
Mm-hmm.
I'll take an Advil and a
Mhm.
Tylenol, or 2 Advil and 2 Tylenol.
Mm-hmm.
But
Not every day.
No,
Yeah.
only when it kind of flares up. So maybe once a week, maybe less.
Yeah, I mean that's
Not very
pretty-
often now.
So Tylenol is okay. Tylenol will not increase your risk of bleeding with this. Advil can, And
Okay.
so my recommendation would just be stay away from Advil if you can.
Okay.
And put ice on it, Tylenol.
Yeah, that's what I did a couple days ago, was put ice on it. Sometimes when it hurts, we
Yeah.
have it's a CBD dragon balm or something. Anyways,
Perfect.
it's a topical, right?
Yeah, and
So
it
I'll
helps.
put on that. It does. It
Yeah.
seems to help, yeah.
Good.
So, meds, follow-up visit,
Yes, sir. That's it.
anything I should avoid, like foods or certain, because I'm trying to get more active.
Yeah, that's okay.
Okay.
That's okay. Yeah. No
Alright.
falling.
No
Big-
falling?
Yeah. Big
I
thing.
promise.
Okay.
And no petting.
And no cut. All right. Don't go home and start operating your power saw or something.
No, I won't do that.
Deep breath for me.
What's that?
Deep breath. Good. Nice and clear. One more of that deep breath. Good. Very good. Very good. Okay. Well, I'll have the nurse come in here and she'll
Okay.
explain the whole prescription thing for you.
So I could probably pick up, normally I go to Rite Aid. Lately I've actually been using Optum RX,
Okay.
but
Probably best to pick this up.
I'm thinking,
Yeah.
because it's only a 90-day supply, I should go local.
You should go local. There's a maybe free, but the company that sells the drug has all sorts of, like Walmart kind of buy one get one kind of thing.
Yeah.
So there's a coupon. I just can't remember if it's a free 10-day or week or whatever. So, but Becky will sort that out.
Okay,
But-
alrighty. I
All right,
appreciate that.
and then before you leave again, we're gonna schedule you. So November, December, January. I would say end of January.
Okay,
Let's rescan you.
okay.
Okay,
So it's only a follow-up for a scan.
right, and then I'll call you.
No blood work needed
No,
to monitor.
no.
Okay.
And then I'll call you with the results of that.
Okay, thank you.
Okay. And you got a primary care doctor?
Yes, I do.
Good.
Dr. Jamie with Providence Health.
Oh yeah. Daily.
Daily, yeah.
Yeah, I'll send her a note.
Okay, cool. Thank you
Okay.
very much.
Good to meet you.
Yes, I wish I didn't have to meet you, but you know what I mean.
Under different circumstances. Yes, sir.